If you're considering whether to invest or to take a supplement called Precardix, you should watch this video. Hi, I'm Herb, a hospital pharmacist that focuses in cardiology, and I help people choose wisely for heart medications. When you look at all the marketing tools, the graphs, and that it's clinically proven, and wait, it's even made in Canada, it's very easy to buy into this supplement. First of all, kudos to the investigators and the company who actually conducted a randomized placebo-controlled trial. They really did push that 89% of people who take the supplement will respond to it, which is great and all, but shouldn't we know what the actual response or the magnitude of effect is? Secondly, kudos to the company for making it super easy for me to find the clinical trial that they published in the International Journal of Hypertension. And after reading the clinical trial, it may not be in your best interest to invest too heavily into this and perhaps even think again before starting or committing to this supplement or company, or before continuing this supplement. If you are already receiving this and are noticing a huge difference and it makes you happy, sure. Whatever I say here is not going to steer you otherwise, but I want you just to be mindful of what the actual literature or the evidence is supporting the use for. Third, kudos to the company and investigators for actually conducting it through an intention to treat analysis as opposed to a per protocol analysis. And the details and the methods for how they actually conducted the study so that you can actually replicate it again was actually very thorough and very well done. However, the big but here is there are several limitations. The clinical trial looks at the blood pressure lowering capabilities of this supplement compared to placebo. But as you all probably know is that blood pressure is what we call a surrogate marker. And what they're testing is for a surrogate endpoint. It doesn't really speak to the things that actually matter to us more, such as lowering the risk for heart attacks, strokes, and death. Sure, I get it. This company is relatively small, it's not big pharma, and it can cost quite a lot of money for them to conduct a larger study to pick out those sort of subtle differences in endpoints and or to run a trial long enough for you to see that sort of difference. They included 144 patients, and right from the get-go, their baseline blood pressure readings were not very well balanced. And for a randomized placebo-controlled trial where their table 1 and their baseline characteristics, they showed the blood pressure readings at baseline, and they also showed p-values for each and every one of those components, which for a truly randomized trial, you shouldn't have to worry about. And the two arms should be balanced on its own. And as you can see that the placebo arm actually had a slightly higher blood pressure compared to the active treatment arm. When you look at the end of the 8 weeks of therapy, the ambulatory systolic blood pressures compared to baseline were 15.4 millimeters of mercury lower in the active arm and 12.9 millimeters of mercury lower in the placebo arm. That looks really good. But when you look at the absolute difference between the active versus the placebo is that it is only a 2.5 millimeters of mercury difference over 8 weeks compared to placebo, which I don't think is clinically significant or meaningful, as we do actually have much more robust literature to suggest that every 5 millimeters of mercury reduction in systolic blood pressure therefore then translates to about a 10% or so risk reduction for heart attack, for cardiovascular endpoints. In all of the marketing, they will talk about that one patient that experienced 35 millimeter mercury drop in blood pressure. And I suspect that this is not related to the actual supplement. And there could be other factors that kind of came into play, like maybe this patient got started on CPAP or something like that for obstructive sleep apnea that they did not actually exclude from this trial. My thought about how they marketed that was that it's kind of unfair. And if you can't replicate the same result in the majority of the sample size, that patient is likely an outlier and should not be used as a marketing tool to help sell the efficacy of this supplement. I have so many questions. It was also very suspicious to me why the placebo arm had a 13 millimeter of mercury reduction in systolic blood pressure. That in itself is more blood pressure lowering than a lot of the prescription blood pressure medications out there at moderate doses that we have on the market that work by the same mechanism of the supplement, like ACE inhibitors. And that is just the placebo. And they use 10 milligrams of rainbow trout oil to help match the smell and the taste of the supplement. I have a suspicion that the blood pressure readings were lower overall, possibly by how they conducted the trial. For example, they had asked patients to abstain from alcohol for 2 days, as well as coffee for 14 hours prior to measuring their blood pressure readings. We know that lifestyle modifications like these can have an impact on a patient's blood pressures. And I suspect that some of this may be sort of playing into the efficacy of why everyone had such a much lower blood pressure. There are 2 active ingredients in the cold water shrimp called phenylalanine threonine tyrosine and phenylalanine serine tyrosine, which I think are some form of amino acid sequence. There's no real mention of the actual mechanism of how this inhibits ACE inhibition pathway, nor does it tell you how these amino acid sequences are extracted from the shrimp. I suspect that chemicals are utilized. Please tell me in the comments below if I'm wrong. Sorry, I'm a pharmacist, not a biochemist. It looks like this product has already made its way on the shelves of London Drugs, PharmaSave, Pure Pharmacy. I hope that people don't think that just because these companies sell this product means that they truly endorse it from a scientific standpoint. Without a doubt, I know that it will probably sell. However, I can't imagine a lot of doctors and pharmacists who are fairly well versed in appraisals of evidence and trials would be likely to endorse this. Again, I do applaud the company and the investigators for actually trying to do a study like this, because it's actually really hard to do and it takes a lot of work, especially without huge industry funding. Unfortunate that they couldn't do a trial that looks at those types of endpoints that I talked about earlier, and for long enough for us to see that kind of difference. So for further studies, if this company is able to demonstrate benefit of blood pressure lowering with these outcome measures that we actually care about compared to contemporary blood pressure lowering therapies, then this could have huge implications. And that's when I would say that it might be worthwhile investing your time and money into. Cost-wise, it's $99.90, or actually now it's discounted. It's actually $89.95 plus tax if you buy a 2-month supply. I don't believe that this is covered by any third-party insurance plans. Let me know in the comments below if I'm wrong about this. This is a message to my community pharmacists. A monthly subscription to this is about $45. So the bottom line, if you want something that's natural, keeping in mind that you've sussed out the details of whether they've extracted the peptides from the shrimp without the use of chemicals, and you want something that's locally made in Canada, that's not made by big pharma, and only have mild hypertension and have no other cardiovascular disease, you're not obese, you're not diabetic, you're not taking any medications or other supplements that can lower your blood pressure, and are willing to abstain from alcohol for 2 days and abstain from coffee for 14 hours prior to your blood pressure readings, and are willing to pay out of pocket without insurance coverage, and don't happen to have shellfish allergies, you could consider this. But please do note that your ambulatory blood pressure lowering may only be on average 2.5 millimeters of mercury lower than if you were just to take placebo over 8 weeks, which really isn't that much and not quite low enough to lower any cardiovascular risk that we actually care about. If you like this video, please give me a rubber stamp of approval, share it with anybody you think who may benefit from this, hit the notification bell, and subscribe to learn more and help you choose wisely for heart medications. Again, thank you all for watching, and remember to say no to drugs.